Welcome to the Psychology and Physical Training channel. Have you ever wondered what really happens during the birth process? It's a remarkable journey, a complex dance of biology and instinct that brings new life into the world. Today we're going to delve into this miracle of nature, shedding light on the stages of childbirth and the unique characteristics and challenges of each. The miracle of birth. Childbirth typically unfolds in three main stages: early labor, active labor, and delivery. Each stage is a distinct episode in the birth narrative, and each presents its own set of challenges and marvels. Early labor, the first stage, is usually the longest and least intense. It begins with the onset of contractions and ends when the cervix is dilated to about 3 centimeters. During this stage, the woman may feel a variety of symptoms, including backache, cramping, and a sense of restlessness. Next comes the active labor stage. This is when things really start to accelerate. Contractions become more frequent, longer, and stronger. The cervix dilates from about 3 centimeters to 7 centimeters. This stage can be intense, and it is often during active labor that a woman may request pain relief. Finally, we reach the delivery stage. This is the grand finale, the moment everyone has been waiting for. The cervix is fully dilated, and it's time for the mother to push. This stage ends with the birth of the baby, a moment of profound joy and relief. Each stage of childbirth has its own unique characteristics and challenges. They require different types of support, strength, and patience. But each stage also brings us closer to the miracle of life, a journey that is as natural as it is extraordinary. Now that we have a basic understanding of the birth process, let's look at the different delivery mechanisms. And now we see delivery mechanisms and stages of childbirth. So, how does the baby make its grand entrance into the world? Well, there are a couple of main routes that our little future citizens typically take. The first, and most common, is a vaginal birth. This is the natural process where the baby is born through the birth canal. It's the method that our bodies are biologically designed for. There are several advantages to this method, such as a shorter hospital stay and recovery period. Plus, the baby gets coated in beneficial bacteria as it passes through the birth canal, which aids in developing its immune system. However, it's not without its challenges. Vaginal birth can be physically taxing and may require a longer period of labor compared to other delivery methods. The second most common method is the cesarean section, often referred to as a C-section. This is a surgical procedure where the baby is delivered through an incision in the mother's abdomen and uterus. C-sections are typically performed when a vaginal birth might pose a risk to the mother or the baby. This could be due to factors such as the baby's position, the size of the baby, or health concerns for the mother. The recovery period for a C-section is usually longer, and the procedure carries the risks associated with any major surgery. The choice between these two methods isn't always a matter of preference. Sometimes, it's a decision made out of necessity, depending on the circumstances surrounding the birth. It's important for expectant mothers to discuss these options with their healthcare provider to understand the potential risks and benefits, and to make the best decision for their unique situation. Remember, regardless of the delivery mechanism, the goal is always the same: to bring a healthy baby into the world and ensure the safety and health of the mother. With the delivery mechanisms covered, let's move on to the different types of birth procedures. And next topic is types of birth procedures. Did you know that there are several types of birth procedures available to expecting parents? Let's start with the most common one, natural birth. This method involves minimal medical intervention. Mothers are encouraged to listen to their bodies during labor, moving and changing positions as they see fit. The benefits of this approach include a shorter recovery time and a heightened sense of control during the birthing process. However, it can be physically demanding and potentially painful without the aid of pain relief medication. Next, let's discuss water births. As the name suggests, this method involves laboring and sometimes delivering in a warm tub of water. The buoyancy can help relieve some of the mother's weight, making it easier for her to move and find a comfortable position. The warm water can also be soothing and may help reduce the need for pain medication. However, there are some risks to consider, such as infection or complications if the baby inhales water. Finally, there's the option of epidural anesthesia. This is a procedure where pain-relieving drugs are injected into a space near the spinal cord. This effectively numbs the lower half of the body, significantly reducing the pain of childbirth. The major advantage of an epidural is, of course, the relief from pain. However, it can also slow down the labor process and may require additional interventions, such as forceps or vacuum extraction. All these birth procedures have their own pros and cons, and the choice often depends on the mother's health, personal preference, and the baby's position and health. It's important for expecting parents to discuss these options with their healthcare provider to make an informed decision that is best for both mother and baby. Of course, these are just a few of the procedures available. There are also cesarean sections, VBACs, vaginal birth after cesarean, and more. Each has its own set of circumstances in which it might be the best choice. As we've seen, the birth process is complex and varies greatly. But what happens after the baby is born? Let's delve into infancy. And next topic is infancy features and characteristics. So, what is infancy, and what are some of its defining features? Infancy, in a nutshell, is the period from birth to the first year of life. This stage is a time of remarkable growth and development. It's fascinating to observe how a tiny, helpless newborn transforms into an active toddler in just 12 months. One of the most notable features of infancy is the rapid physical growth. Babies almost triple their birth weight within the first year. And it's not just about the physical size. Their internal organs, like the brain, experience extraordinary development. Speaking of the brain, it's during infancy that the foundations for thinking, language, vision, and emotional intelligence are laid. Babies start to recognize faces, respond to voices, and even mimic expressions. It's the beginning of their journey to understand the world around them. But it's not all about the brain and physical growth. Infancy is also characterized by the development of motor skills. Babies learn to roll over, to sit, to crawl, and some even start to walk by the end of the first year. These skills are their first steps to independence, paving the way for exploration and learning. Yet, despite these rapid developments, infants are entirely dependent on their caregivers for their needs. They rely on adults for feeding, comfort, and security. This dependence builds the foundation for trust, teaching the infant that the world is a safe place. Language acquisition is another fascinating part of infancy. While it starts with cooing and babbling, by the end of the first year, most babies can say a few words. They start to understand the meaning of words, and importantly, they learn that sounds can represent objects and ideas. Infancy is a whirlwind of growth and development. It's a period of discovery, learning, and immense change. It's a stage where the groundwork for future skills and abilities is laid. Understanding infancy is crucial. But what are some of the hazards that can occur during this stage? And last but not least, we learn about hazards during infancy. What are some of the hazards that can occur during infancy, and how can they impact a child's development? Infancy is a crucial stage in human life, a time of rapid growth and development. But it's also a stage fraught with potential hazards that can significantly impact a child's future. One of the primary concerns during infancy is physical health issues. Babies are vulnerable to a wide range of health problems, from common illnesses like colds and ear infections to more serious conditions such as heart defects or metabolic disorders. These health issues, if not addressed promptly, can lead to long-term complications, impeding a child's physical growth and development. Malnutrition is another significant hazard during infancy. Infants need a balanced diet rich in nutrients to support their rapid growth and development. Malnutrition in infancy can lead to stunted growth, cognitive delays, and increased susceptibility to infections. It's not just about quantity, but also quality of food. Infants need a variety of nutrients, and missing out on any can lead to deficiencies and associated health problems. Then, there's the issue of care. Infants require constant attention and care. Lack of proper care can lead to a multitude of issues, from physical health problems to psychological distress. Infants who don't receive adequate care may develop attachment issues, leading to difficulties in forming relationships later in life. Let's not forget about the psychological hazards. Infants are highly sensitive to their environments. Exposure to stressful situations or traumatic events can affect their developing brain, leading to emotional and behavioral problems down the line. As you can see, infancy is a delicate period, and the hazards during this time can have far-reaching implications. But it's important to remember that these are potential hazards, not certainties. With proper care, attention, and medical intervention when necessary, many of these issues can be prevented or mitigated. As we've seen, the journey from birth to infancy is filled with challenges and hazards. But with understanding and care, we can ensure a healthy start for every child. And if you feel this video is useful, do not forget to like, share, and subscribe to the Psychology and Physical Training channel. Thank you for watching.